Welcome to our informational video of our Falsafa research paper titled Women Equality in Healthcare Access. According to a report from the World Economic Forum and the McKinsey Health Institute, women spend 25% more of their lives in debilitating health than men. The disparity in healthcare between men and women is known as the health gap. This gap can take shape in a variety of ways, including research and care access. For instance, the women's health gap equates to 75 million years of life lost due to poor health or early death each year. Uneven distribution of access to necessary services such as prenatal care, reproductive health, and preventive screenings frequently exacerbates health inequities among marginalized communities. As advocacy for women's health gains momentum, addressing these disparities is crucial for ensuring that all women receive the comprehensive and equitable care they deserve. In this context, understanding and improving access to women's healthcare is not only a public health priority, but also a fundamental issue of social justice. Women's access to healthcare in 2024 is a crucial and critical topic that is covertly neglected in discussion. Therefore, our research revolves around women's equality in healthcare access.
For centuries, women and girls worldwide have suffered from gender inequality and an uneven balance of power between men and women. In some countries, female healthcare providers have been prevented from or face barriers to practicing their professions or being promoted to leadership positions due to religious and/or cultural convictions or discriminations based on the intersecting grounds of sex and religions or ethnicity. According to Article 1 of the Convention on the Elimination of All Forms of Discriminations Against Women 1995 Chadal, according to a study in August 2024, doctors treat men and women differently when it comes to pain. Women are 10% less likely than men to have their pain level assessed when they arrive at the hospital, the study found. Women also wait around half an hour longer than men to be seen by a doctor and are less likely to be given pain medication. Dr. Alex Gilales-Hilo, researcher of publications at the School of Medicine, states that women are viewed as exaggerating or hysterical and men are viewed as more stoic when they complain of pain. There are questionable statements which mention that treating men and women equally in the healthcare system is regarded as an achievement in gender equality. In reference of Principle 1 of Chadal, equality is the obligation to respect and take into account that men and women are different. The differences shall be acknowledged and responded to for equality to be achieved. In May 2024, Bill and Melinda Gates Foundation published in The Lancet stating that women live longer than men but spend more of their lives in poor health. It was found that women were more likely than men to experience lower back pain, depression, and even headache, while men shall have higher mortality rate in COVID-19. This concludes that there are health differences between males and females, and there is an urgent policy that healthcare shall be more sex-specified and not use the all-fit-in-one system. This research aims to analyze the differences between male and women in the healthcare system and continue promoting gender-sensitive research to not only reduce burdens from sickness, but also achieve greater heights in gender equality, especially for women in the healthcare system.
Our first research objective is advocating for legislation that protects women's healthcare rights. Advocating for legislation that protects women's healthcare rights is crucial for several compelling reasons, as access to healthcare is a fundamental human right, and gender should not be a barrier to receiving care. Secondly, to propose solutions for women to receive equitable healthcare access. Achieving equitable healthcare access for women requires addressing a range of factors that can limit access to care, as well as systematic barriers that disproportionately affect women. And lastly, to create a safe space for women in healthcare. Creating a safe space for women in healthcare is not just about physical comfort. It's about fostering a culture of respect, empowerment, and inclusivity. Safe spaces in healthcare promote gender equality, reduce discrimination, and ensure that all women receive the comprehensive, compassionate care they deserve. To analyze information for our case study, we selected content analysis as our research method and interviewing to collect valid data.
Above refers to the background of our responders.
So I think women, our biggest obstacles in healthcare is that we face access issues. So for example, long distances to clinics, so especially in rural areas. So if we were to apply it to countries like us, a developing country, not a developed country like Malaysia, so if we were to apply it to like kampong areas, then this could be an issue in women in remote towns where many may not have. So if you know what OBGYN is, it's basically like a treatment for pregnant women. This can be something that is like zero in kampong.
There are different needs for both men and women because we have different reproductive systems and different biology overall, which should be recognized, these differences. And women have issues that are related to pregnancy and menstruation and all of that. So there should be health policies that ensure women have access to those for their unique needs.
Women in poor or minority communities often have worse health outcomes. Honestly, this is just because of their socioeconomic status, so they get really discriminated. So for example, a low-income woman should receive the same quality of care treatment as someone who's wealthy.
I think it's good to take additional steps to ensure women feel heard and are treated properly.
I think that when we talk about underprivileged areas, we would consider these women to be of lower like socioeconomic backgrounds, and like the infrastructure and facilities around them are not much. So I would say we would have to increase women's access to healthcare by giving them more affordable healthcare and letting them have insurance and all of that.
So, my definition of a safe space would be an environment where I would feel that no one is judging me and I'm not being discriminated, especially in a healthcare environment. So where when I am to express my concerns regarding my health, the doctors or the nurses, they won't judge me in any way, that I'll feel free and safe to do so.
These are our compilation of data from our findings and discussion.
The data collectively underscores the need to address the gender health gap across various domains, from psychological distress and burnout in healthcare to mistreatment in maternity care and the quality of life. Women experience greater health challenges than men, and efforts are needed to address these inequalities through better healthcare access, mental health support, and policies that prioritize women's well-being in both developed and developing regions.
In conclusion, the value of research on women's equality in healthcare access lies in its potential to uncover and address systematic disparities that affect women's health outcomes. This research is crucial for informing policies that promote equitable healthcare, ensuring that women, regardless of their background, have equal opportunities to access essential health services, including reproductive health, mental health care, and general medical treatment. Furthermore, research on women's healthcare equality can lead to the development of targeted interventions, such as gender-sensitive healthcare policies and better healthcare infrastructure. It also helps to raise awareness of the health needs of women and the importance of considering these needs in healthcare delivery. Ultimately, it fosters a society where women's health is prioritized equally, promoting overall public health and social well-being. Thank you.